reading a report that was launched at the NHS Confed last week called Stepping into the Place. I don't know if people have heard of this. And it plays directly into the agenda that we're talking about today. So it's about how all the big services, the county-wide organisations, become more centred around GP practices. And it specifically mentions neighbourhoods in this report, and it describes what the system's got to achieve for the individual, for their local community, for the health and social care system, and for the government. It's quite a useful way of setting out how we all spend our money, but how we deliver the service but not miss a point. So I recommend that report to you all. The themes that are in it have been picked up by colleagues who've introduced so far. So something about a shared commitment to working together for ultimately for the person. Something about making sure that all of our services are centred on the individual, and we do whatever is necessary, even if it's not strictly part of our job, to make sure we're preventing that further need for health or social care. Something about a commitment for change for senior managers, so that they do enable their staff to take risks, do something different, and ultimately help people. And finally, something about a preventative approach. Which again, it's an easy thing to leave to the back, particularly when you're short of money, is investing in prevention for the future. So all that's mentioned in the NHS Confed report, stepping up to the place, and I do recommend that to you all. I was thinking about social care. I've been here for 8 years now, and when I arrived, 75% of our referrals in social care came from either GPs or from people's families. And they came into our call centre, and that's 3/4 of our work. 25% of our referrals came from hospital. So that's what it was like 8 years ago. Today, it's 50-50. So we've had a massive shift of activity, and 50% of our referrals now come through the call centre, and 50% through hospital. And I'm sure hospital colleagues will recognise that the numbers of people coming through, numbers of complex people coming through who need support to get out again, has risen dramatically. So we've had to adjust our resources to cope with that, and that's partly about so-called bed blocking, delayed transfers, and helping people leave, but also investing in services at the front end to try and stop people going in there in the first place. And social care, we now spend 12 or 15 million pounds we didn't spend before on services to enable people and keep them out of hospitals. We've had to change our investment and change what we spend our budgets on. So it's not only about the money, that's a very compelling reason why we need to change, but even more compelling is the fact that our population has changed around us. Even in the last 8 years, changed dramatically. People are frailer, people are older, people are fiercely independent, and people are hanging on at home to the last minute, and then they're going to hospital. And that's when social care is picking them up. So if there's no other compelling reason to get together and do something, it's the fact our population's changed, and we must too. So you've got my commitment to work together with health colleagues, my commitment that we'll centre our services around the person, that we'll integrate, we'll align our staff, we'll share our information, and that we'll do this integration thing in Hertfordshire. We've got the relationship, so I think let's just get on with it. Okay, now it's my pleasure to introduce Roger now. Now Roger's had the benefit of writing his own scripts. I've never met Roger before, so I've got no ammunition on Roger. As Peter said right at the start, Roger Skeensey is not a clinician. However, he has worked across both the public and private sector, and his speciality is dealing with thorny issues, with the really complex issues that are not easy to solve. If they were easy, we'd have done that already. So we're very pleased to have him here today. He's come all the way from New Zealand, and for that reason alone, he deserves a huge round of applause and a welcome from us.